Next, you're going to put on gloves. And I place the child's hand volar side up because you're going to be putting 2 strips of cast here, and this helps with positioning and helps to keep the cast tape on. You can do the focus rigidity in 2 ways. You can measure the length of their arm up to the fingertips and back down and cut it off, and then you'll have a separate roll that you're using to wrap around. You would have to dip both the focus rigidity and this roll into the water separately. The way that I do it is I measure the length, then hold the roll, and together I dip this in the water 1 time, gently squeeze the excess water out, lay it on the child's arm up until I can feel their long finger. Then I'm going to fold my roll over like this and wrap around. With Delta Cast conformable tape, you want to only overlap by half of a roll, and you want to gently be pulling as you're bringing it around the child's hand. When you get to the thumb, you're going to make a snip. Go around the web space. Make sure you're coming all the way to the tip of that thumb. I'm going to make a trim on the proximal end 1 more time, and then wrap around, and then continue overlapping only by half the width of the tape. When you come to the end of the cast, if you have extra tape, just cut it off. I just put it in the water. Now you're ready to form it. So using the parent's hand, I'm going to push down. I want to make sure I'm capturing the arches in the hand. I use one hand to grasp the thumb and push down. The other I use at the fingers and the metacarpal joint to help put some pressure down into the forearm. I'm going to use my hand to help smooth the cast down their arm. The reason we put them into this position is 1, it's more challenging for the child to remove it. And 2, it puts them in a little bit more of a functional position. So if this child wanted to ride his bike or scooter while he was wearing this cast, he would be able to do so. So I'm going to continue to smooth the cast tape. I want to come up to the fingers, and I'm going to gently spread those fingers out to give the child a little more room. And you know this cast is ready when it's not sticky, no longer sticky. Remembering the purpose of this cast is to block their use of this hand while we are encouraging them to use their non-dominant hand. When the cast feels like it's set and not sticky anymore, you're going to use scissors to cut the cast off. You go along the zip stick The child may feel a little pressure, but it shouldn't hurt them. And you can take the stick out. Sometimes I'll remold it here for a minute, let it finish setting. Okay, and then you can slide it off the child's hand. You can put your hand up. Now to finish it, you're going to trim the edges. It should be fairly easy to cut if you didn't make it too thick. When I try it on the child's hand again, it should open very easily. Slide your hand in just like you're putting on a glove. And it closes well. Next, I'm going to trim the thumb. You can take a wax pencil to draw where their thumbnail is along the dorsal side of their thumb. I'm just going to eyeball it today. This helps with ease of putting the cast on and off. If the child was having trouble getting their thumb in, you could just help grab their thumb and gently pull. Good. Next, what you're going to do is take your Velcro. We use the Delta Terry Net 1-inch hook and the Delta Terry Net 1-inch loop. I measure the Velcro circumferentially around the cast. This one I'm going to put 3 straps on it. Thank you. One at the proximal end, one at the wrist, and one at the fingers. If you wanted to mark where you're putting your Velcro on the cast, you could also use your wax pencil. Next, I would take a heat gun, which I'm not going to do right now, but you would take a heat gun, stick your Velcro to it, and heat up the Velcro sticky side out so it adheses more easily to the cast. Once it is heated, you're going to wrap it around like so, and then smooth so it sticks well to the cast material. If there's a little bit extra, I just trim that off. This cast is more narrow here, a little wider here. So one trick that you can do for your Velcro is make a little slit. Again, I would heat it with the heat gun, and then the slit at the wider section. And start at the wrist. It helps to spread it out and keep it even across the cast. Again, I'd heat it with a heat gun and then place my last piece of Velcro. Smooth it so that it adheses well to the cast material. Then you're going to use your Delta Terry Net liner. This liner helps to seal the edge so it's not rough. It's like a fleece liner. I take the liner and I measure the length of the cast. I take this along the inside edge. I seal it on the inside edge, and then I wrap it around the outside edge like this. Trim the excess. Repeat it on the other side. Wrap it around the outside edge. Trim the excess. We're going to repeat this for the proximal end. Starting on the inside edge. And wrapping around to the outside edge. And you're going to do it for the distal end. Wrapping it on the inside edge first. To the outside edge. Trim your excess. And then the last piece is the thumb. To do the thumb, I usually measure the length. And I take my moleskin liner and I cut it in half. Place one on one side, wrap it around the edge. One on the other side. And wrap it around the edge. Then before I put my Velcro straps on, I put the child's hand back into the cast and make sure it still fits well, that the edges are able to come together, which look good. And then we add our straps. We're going to use, again, the Delta Terry Net stretch loop. It's elastic. I start on the fuller side, wrap all the way around, and then trim. The last step is you take this moleskin liner. I'm going to cut 3 squares or small rectangles. And I'm going to make a flap here to make it easy to grab. And it also helps the strap from fraying. Okay, now we're ready to go. This side will always stay on the Velcro. Again, it should open easily. Slide the child's hand in and strap it on. And that's how you make a Delta cast conformable removable resting hand orthosis for our constraint-induced movement therapy program.